Ziguzia sana kwa ufupi kwa sababu ya masaa, and then the next time we'll be able to plan our program to have enough time. Mambo zingine inabidi uende kiutaratibu ndio ingie kabisa. The healing power of Jesus Christ. And also I'm a firm believer of the word of God. Okay? When God says that people perish because of lack of, today we are here to get some knowledge. I'm not here to despise our faith in healing, right? And I'm not here to discourage those who are going through trials. Sometimes when you're handling these sensitive topics, they bring people down. Zingine zinawakumbusha mengi, maana umepata mtu ambaye maybe hata wewe mwenyewe unapitia. Lakini kwa hayo yote, tuko na Mungu. Lakini hatutakataa kujua ukweli wa mambo. Tuko pamoja? Aya, so today I'll take you through common cancers among women. And if time allows, we'll look at STIs. So I will start by defining what cancer is. Na jina cancer ni Greek. Inatokana na Greek word called carcinos. Carcino ni crab. Ile nini inatembeanga kwa maji inaitwa crab. And basically cancer, nimeacha hizi slides, so if you want them, the notes you can be given. So feel free, okay? Listen to me, understand, just take a note. In case you have any question, andika, then you just forward them, then I'll be able to respond to them. So if you look at cancer, it is just a group of disease characterized by, number one, wakati tunasema mtu akona cancer, tunamaanisha kuwa cells or tissues are displaying uncontrolled growth. Kuna vile cancer, cells za mwili zinafaa kuwa zinakuwa. Wakati mtu anapata cancer, zinaongezeka maradufu, zinaanza kusonga. Kama zilikuanga sehemu moja ya mwili, zinaanza sasa kuongezeka mpaka zinapenya kwa hiyo sehemu ingine. Ama zina spread to other locations of the body. Kwa hivyo ni cells za mwili ambazo kawaida ziko normal, zinaacha kubehave normally. Tuko pamoja? Okay. Na kwa nini basi watu hupata cancer? The real cause of cancer is unknown. Lakini kwa sababu watu wamefanya utafiti mingi, kuna zile vitu wanasema they are predisposing us. They are risk factors ambazo tunaweza angalia kupunguza watu kupata cancer. Na hizi zingine sisi kupunguza maana ni maumbile. Lakini kuna zile tunaita lifestyle ambazo sisi wenyewe tunaweza angalia. Tukiangalia intrinsic, hizi ni biological, vitu ambazo wewe mwenyewe uko nazo. For example, umri. Tulikuanga tunaona cancer sana ikiathiri akina nani? Watu wazee ama wadogo? Wazee. Mambo ya hormones. Sana sana unapata kama hormones za wanawake, kuna ile inaitwa estrogen hormone. Inakuanga pia ina misbehave. So kuna vile hormones na cancer pia ziko related. Kuna wale wanawake wanaweza produce excess estrogen. Wakati una produce excess estrogen, then you are at risk of getting cancer. Family history. Kuna wakati unapata inafuata familia fulani. And I know that is where now we start breaking the family. Sindio? Kwa Ukristo hapo ndio tunaanza kusema hata kama ilishika babu yangu ama baba yangu, haitanishi. Sindio? And then genetically, there are some genes in you, and mostly it's still about family. Genes ambazo zimekuwa kwa hiyo familia, zinaendelea wale wa sigara, wakukunywa alcohol sana, unapata wako na shida na maini, unhealthy diet. Sahi kila kitu ni microwave generation. Hata mayai watu wanapika na kila kitu, kama ni njugu karanga, utaki ziungu unaweka kwa all those lifestyles. Then exposure to toxic chemicals. Hewa yetu imeharibika sana kwa sababu ya industries, and those are some of the risk factors that we are exposed to. Alafu if immunity is low, you're also at a higher risk. Environmental factors like vehicular emissions. Hizo ni zile gases unapata kuna zile magari hata they are not maintained, ndizo hizo mamoshi. Ideally those are all risk factors in the environment. And then we have occupational kama asbestos, zile za mabati, dyes and so forth. Tukiangalia sasa hivi tulivyo Kenya, cancers are the third cause of the deaths in Kenya today. Cancer is the third cause of deaths. Unfortunately, 80% are diagnosed in late stages. Already that is telling you our health-seeking behavior is not good. Yani kabla igundulike, iko stage 3, stage 4. 60% of the cancer patients, they are below 70 years. Si ile kitambo tulikuwa tunasema watu wachanga hawapatangi cancer. But the risk of dying from cancer is 14%. And especially if it is diagnosed early. So it is not a death sentence, especially if you get to know it early. And we know, of course, in Kenya we have resource that is limited. Sindio? Watu wanababaika, wale wako na cancer sana, unapata ni hospitali kidogo zinaweza wahudumia, madaktari fulani, very expensive and so forth. But it's important to know that every single day we are losing 90 lives because of cancer. And 131 people every single day are being diagnosed with cancer. So it is generally on increase. Inaongezeka kila siku. Yeah? But the good news is 40% of these cancers we can be able to prevent. Tunaweza fanya nini? Zuilia 40%. Bad news ni ile nimewambia, late diagnosis. Tukiangalia next slide, the most common cancer in Kenya today is what? Mnaiona hapo juu. Breast cancer, 12.5%. Na sana sana breast cancer iko ni ya wanaume ama ni ya wanawake? Ingawaje hata wanaume upata, but I mean very few men. And then the second one is cancer of the, ni ya wanawake ama wanaume? Wanaume hawana cervix. So basically hiyo ni wanawake. Esophagus ni kila mtu, and the rest. Kwa watoto sana sana utapata wale wengi wanapata cancer ni ya damu, ile inaitwa leukemia. Something nataka tujue, I'm going very fast because of time, ni kuwa when we look at the incidence na mortality, as much as incidence ni occurrence, utapata breast cancer ndio inapatikana haraka sana kwa watu wengi, lakini ikikuja kwa kuua, si breast cancer inamaliza watu sana. Watu wengi wakiwa na breast cancer, they can really be managed. Ile inamalizanga sana ni esophagus. So we still have a chance to save the lives out there, and also our lives, by ensuring we get screened and we get treatment early. And also we prevent ourselves. Tuangalie lifestyle zetu. So let me do now what brought me here, breast cancer. Na sitasema statistics sana but breast cancer, tukiangalia in Kenya, it's the leading cancer, hiyo nishaongea. Na unaangalia in annual deaths, yani watu 2,553 wanakufa na cancer every year, breast cancer. So I'm not here to scare you again. I'm just giving you information of what is happening in the medical field, so that all of us take caution and also pray. Sindio? And also, so as we pray, let's also our faith have action. Next. So risk factors za breast cancer ni gani? Sana sana unapata ni family history. Those are risk factors. Genetics, hizo zote tushaongea. Yeah? Personal history. Kuna wakati probably unapata breast yako ilikuwa na kitu, ukaenda hospitali, ukaambiwa si cancer, ikaisha. It is important you always go for screening. You might be at risk. Reproductive and menstrual history. Sana sana ukiangalia kwa researches unapata people who have never had any children, they are even more at risk because of the estrogen levels. And having your first child after 30 years, and I'm not telling you start getting children anyhowly. It's just a risk. Okay? Ati sasa now mimi ni 20 years na sasa sitaki nifike 30. Sijasema hivyo. Yeah? Early onset of menstruation. Kuna wale huanzia menstruation very early, meaning their body, their estrogen levels are very high. Pia hao wanakuanga at higher risk. Alafu use of postmenopausal hormone replacement therapy. Kuna watu hawataki kuzeeka na hawataki kukubali. Ukifika menopause, hutaki kufeel symptoms, so unaanza kujiongezea hormones. So ndio ukue kawaida. Hutaki hiyo mambo ya hot flashes, uko na fan kila wakati. Sasa unaambia niekeni hiyo hormone inaisha, niweze kukaa maisha yangu ya kawaida. So you're also exposing yourself the more. Exposure to previous chest wall radiation. Kuna watu ambao wakigonjeka kidogo wanataka x-ray. Hata waandikiwe na daktari, they want to go and have an x-ray done. Even they recommend. It's very dangerous to have so many exposure of radiation. Tuko pamoja wa mama? Alafu maana sana sana inapiganga wapi? Breast density. It is believed women with dense breast tissue have a higher risk for breast cancer. Na hii haimaanishi ati dense breast tissue ni nyonyo kubwa. Hapana. It's about density. It's not about the size. Usianze kuziangalia. Okay? Usianze kufanya nini? Kuangalia. Useme, zangu ni kubwa, zangu ni ndogo. It's about the density. Lifestyle. Lifestyle kwa mama sasa hapa sijui. God will help us. We are most likely obese or the other way. Overweight. After menopause, unapata hata you cannot control your weight anymore. And that increases your risk for cancers. Alcohol. I believe here no one takes alcohol. You're safe. Physical inactivity. Haufanyi mazoezi, uko tu, mwili uko tu. It is important to always ensure that you are active. Tobacco use, I said. Breastfeeding longer than 1 year protects you because it balances your hormones. Okay, so wakati hata tunaambia mama, nyonyesha mtoto. Wacha kumnyima ati zitasag. Zitasag ni za kazi gani basi? You can maintain them even after breastfeeding. Just hold them nicely when you're breastfeeding. Si ndio? Lakini ukiachilia tu mtoto anyonye, we unafanya shughuli zingine, si hata ivuruta tu. Ama itavurutika. Usaa utakuwa tu nairusha. Alright. Sawa sawa. So, wacha tukiongea kuhusu signs and symptoms. Nini hasa mtu anaweza angalia aone akimbie hospitali? I'm sorry, I'm rushing because of time. Yes. So if you find, by the way, how many of us ever look at themselves naked kwa kioo? Ni dhambi? Hasa ni dhambi? Utaki kuona dhambi? We ni dhambi? Do you ever admire yourself on the mirror? Do you know your normal self, how you look like? Wengine wanacheka because they have never thought of. You need to know when you are normal, how do you look? That's the only way you'll get to identify when something is abnormal. First, get to know how you look like. But if you are 40 years and you have never known that you have a black spot on your breast, the first time you see it, you rush to the hospital, and it's a birthmark. Ulizaliwa nayo lakini hujai fanya nini? Hujai kagua, hujai iona. It's not a sin to just get to admire yourself and get to know your real self. So nipple retraction ni ile unapata, si mnajua nipple ina turn inwards, ina sink ndani, kumaanisha lazima ukuwe umejua nipple yako kama ni ile inachomokanga sana ama ni ile kawaida, hata kunyonyesha mtoto ni shida, ndio uweze kujua ikifanya nini, ikirudi ndani. Tuko pamoja? Unexplained discharge and bleeding from the nipple. Kama hauna mtoto ananyonya na ukifinya nipple inaanza kutoa either uzaa, damu, inatoa tu substance, you need to go for check-up. Breast skin changes, ndio nasema sasa skin changes lazima ukuwe umejua kama uko na alama ya black kutoka kuzaliwa ama imedevelop. Na sasa skin changes inaweza kuwa maybe ina peel. When it is peeling, unaona ngozi ni kama imekauka sana. Dimpling, you know the dimples? Yes? Breast inaanza kupata some dimples. And puckering. Puckering ni kama, you know an orange, eh? Ngozi ya orange inakuanga na uto tushimo, si ndio? So that is the puckering. Changes in size and shape. Will you know that without getting to know yourself? So you need to know how big your breasts are, the shape of your breasts. And then a lump or swelling in or near the breast or underarm. Kianza kusikia kitu inafuria, hiyo pia ni dalili inahitaji chunguzwe. And then pain. Kianza kusikia uchungu and you're not ovulating, you're not on your menses, because sometimes this pain, sometimes when people are ovulating they get some pain, si ndio? And others when they are menstruating you get some pain. Then other days you need to visit the hospital. And this is what I mean. Go to the next slide. I don't know if you can be able to see that breast. The nipple is retracting ndani. Yes. Then becoming reddish. Iko na dimples. Yeah. And then you can see one is bigger than the other. The shape is different from the other. All those are things that we can be checking. And let it not be that you're now so fearful that every single minute you're on the mirror. Eh? Najua after these people will be in the bathroom checking. I don't suggest that you have to check every single, yeah? So when we are screening for breast cancer, there are several ways. Kuna ile inaitwa mammography, ambayo iko recommended for the average risk population. Yeah? Alafu kuna ile ingine inaitwa ultrasound. Unafanywa ultrasound ya matiti together with the clinical breast exam, especially for 35 to 39 years. Alafu kuna clinical breast examination. Tuna recommend ufanye self breast exam. How many have ever conducted a self breast exam? Yani unajua kujifanyia examination. Inua mkono vizuri. Ama ni kwa sababu pastor ako hapa? Pastor ana shida. Inua mkono vizuri. Half of us. And the other half, how do we do it? Can someone demonstrate? I'm not saying you remove your nini. You just tell us what you do. Thank you.
Okay. I study in the mirror with Adam suit. Then I place my hand here. I test with my fingers. And I start with this side. I squeeze, nothing. In the rower, nothing. In the other side, nothing. The other side. Then I come to nipple, I finger. Nothing coming out. Then the other side, the same thing. And I feel my nyonyo is comfortable. Yes.
Makofi kwake. You see, you have a mom in the house who knows how to do it, right? Yeah, it's exactly that. So make sure wakati una palpate na wapi? Na wapi? See na fingertips. Okay? Yeah. You just imagine the breast is cut into 4 pieces. So that is the 4 quadrants. You go and you make sure your hand is like this. Okay? Yes. So you palpate slowly to just listen to any mass. Kitu yoyote kivimbe ndani. Tuko pamoja, and you should not be feeling pain. When you press your nipple, it should not have any discharge. Tuko pamoja hapo? Have we learned? Any question? Breast cancer nimemaliza. Aya. Cervical cancer. Do you know what is a cervix? What is a cervix? Yeah? There? Njia ya uzazi, eh? Na njia za uzazi ni mingi. Anyway. So I will show you something on how to locate a cervix. A cervix is something you don't see on your outer, right? It is the inner opening of the uterus. It is the opening of the uterus. Na uterus unaionanga? Hauioni. Ni kakitu kadogo kakotu na katip even, I'll show you. And that is where the cervix, the cancer begins. So it is inside. You'll not see cancer outside. And it happens when the cells on your cervix begin to change. Venye tu nilisema, cells ndizo zinaanzanga misbehave. Zina change shape, zina change everything, zina grow sana, zinaanza kusonga. Then, not all precancerous cells will turn to cancer. Sometimes kuna kuanga na changes on the cervix, na si ati ni kwa sababu ya cancer. Ni kwa sababu ya many things. Trauma, kuumia, or even changes in the hormones, or any infection, vitu kama hizo. And then, what causes cervical cancer inaitangwa HPV, human papilloma virus, nika virus. And you know virus hazinanga nini? Dawa ya kutibu, sindio? Ni ya kumaliza dalili. And human papilloma virus is transmitted sexually. Okay? It's just like any other STI. HPV is a virus, lakini sasa nayo iko aina mingi, over 100 types. But not all 100 types ambazo zinaweza sababisha cancer. Just a few types ambazo zinaweza leta cancer of the cervix. Meaning, mwanaume anaweza ibeba, atabeba hii HPV, lakini yeye haitamdhuru kwa sababu hana nini? Hana cervix. But ikiland kwa your cervix, hapo ndio maneno iko. That's how our uterus looks like. Next slide. Yes. So where you can see cancerous tissue, you can see that ball there, hapo ndio tip ka cervix, hiyo ndio cervix, even ndivyo how it looks when you unaenda unamulikwa hospitali, iko hivyo. Alafu unaanza kuona some tissues, some changes on the tip of the cervix. So wakati tunawaambia enda hospitali uangaliwa, I know it is very uncomfortable. Sindio? Yeah, you always postpone. Hata mimi niko na tabia ingine mbaya, lakini sitaki kusema hapa kwa madhabahu. Tabia ya kupostpone. Nitaenda. But you make a decision. I remember this year March, I had to make a decision. Because now, you'll keep on wondering, listening to news. Unasikia mambo mob. We mwenyewe haujishughuli. And then, let me just make you laugh. After the test was done, I took another 3 months to go for the results. And I was like, what? Yani, it's a process like that. And devil gives us a lot of fear. But it's better to know early enough and then prevent it and cure it. Sindio? Yeah. So I'll not go to the statistics in Kenya because they are just worrying. But what I can say is, if there is any cancer that we can be able to prevent and eradicate, is the cancer of the cervix. Yes? If we can be able to prevent other STIs, sexually transmitted illnesses, then we can be able to prevent cervical cancer, because HPV is one of the sexually transmitted. Number 2, when it gets into your cervix, it does not cause danger right then. It can take a lot of years, 10, 15, 20 years, before it manifests to a cancer. So what have you been doing for a whole 10 years and you don't visit a doctor to check? Do you love yourself? Eh? Na imagine hizi vitu ni free, so utaniambia ni pesa. Kwa Kanjo, testing ni free. Tafadhali jipe. For you to become a woman of influence, love yourself. It is biblical to love yourself, because if you don't know how to love yourself, will you be able to love others? No. So it progresses very slowly, so it can be averted. We can stop the cancer from developing if we get to know mapema. What are some of the risk factors? So if we have said it's sexually transmitted, if we can be able to stop early sexual activity among our adolescents. Yes? Siku hizi watoto wanaanzia ngono miaka ngapi? Yes? At 11? 9, even earlier. But 9 years is a lot. Yes? And now when they start exposing themselves to sexual activity, there is likelihood that they'll have this virus very early. And that is why I'll show you one of the ways of preventing is giving them a vaccine when they are young, before they start engaging into sex. Number 2 is having multiple sexual partners, just the way other STIs are transmitted. If you have so many partners, you can't tell who is carrying the virus, the HPV that can lead to cervical cancer. Having a sexual partner with multiple partners, you can be faithful. But do you know about your spouse? Yeah? Yes, you're born again. But I believe not all our spouses are born again. So that is also another thing. Co-infection with other STIs. So kama unapata kila wakati uko na some STIs, you're also at risk. And maybe if you have other infections that reduce your immune system, like HIV, you're also at risk. And then multiparity. Kukua na watoto wengi zaidi. Yes? Every organ of the body gets tired. Yes? Umayona mama amepata watoto mpaka the next one akienda kupata inakuwa bubbles. I've ever seen. Yes? Inakuja tu vitu zinakaa bubbles. Hata si mtoto na tumbo imefura for 9 months. Yeah? Anyway, I know for this time round, no one even wishes to have so many children, as much as we want to fill the earth. Economy, sindio? Ama kila mtoto na sahani yake. We need to take care of ourselves. Tobacco. Yeah? So, how is it screened? We thank God we have service providers here who are going to provide some screening for us. There are several types of screening. Unaweza enda upimwe hiyo virus. Na hizi vitu zote, wacha sasa niwaambie, lazima utafungua miguu, tafadhali. Na daktari hana haja ingine, okay? Daktari hana haja ingine. Na hata ukitoka hapo hakumbukangi nini ameona. Si ndio daktari? Simama uambie kama unakumbuka zile zote umeona. Hakumbuki. Kwa hivyo wacha uoga. Ati sasa ataniona aje, yangu inakaa aje. I mean, that's none of his business. His business is to ensure he takes that sample. Tuko pamoja. Yeah, by the way, you don't even remember. I think that is something you can't even tell. Tumezalisha mama wengi, but you can't even remember who had the big one, you can't. Those fears of privacy, please, acha uangaliwe. So there is visual inspection, ili ambayo pia anatoa, hii atoi kitu, anapaka some inaitangwa lugozayodine, alafu anaangalia kama kuna any changes in the cell. Si tumesema unaanzianga cells zina change. So lugos zinampatia visibility ya any precancerous cells. Alafu kuna pap smear. Ile ana swab, alafu unaambiwa urudie majibu. So mkienda pale atawaambia nini anafanya, si ndio? After umetestiwa, then atakwambia how often. If there were some symptoms, atakupatia muda mfupi. If there were no symptoms, you can even go after 3 to 5 years. And you can see this is a cancer which develops pole. Can you imagine you can prevent it? If you just have your screening every 3 years, you can prevent it. Okay? To go next slide. Next one again. Next one. So via vile nimesema na time ya kuambiwa, let me not talk it about 3, whether you'll be given 3, daktari atakwambia. So the symptoms, what can you see so that now, and by the way, if you wait until you see these symptoms, utakuwa umejiumiza. Because already when you have some symptoms, it tells you it's no longer very early. Because in very early stages, there are no symptoms. Very early stages, you're not seeing anything. Then in some early stages, utaanza kupata vaginal discharge ambayo inanuka. Sometimes unapata irregular bleeding. It's not your time to have menses, tena unapata bleeding. At times postcoital bleeding. Wakati una have sex, just after sex, you start bleeding. Your cervix is so irritable. And then postmenopausal bleeding. Ulisha maliza chapter. We ushapita menopause, lakini tena umeanzia kupata menses. That's not a good sign. In late stages then, unaanza kupata sasa, because now it may invade other places, other organs of the body. Sasa unaanza kushindwa hata kucontrol mkojo. Backache, sometimes it can spread to your spine. You start having backaches, pelvic area yote iko inflamed. And then lower abdominal pain. Yeah? Unasikia uchungu sana. And I'm not saying if you get these symptoms that you have cancer. Okay? That automatically it is cancer. But these are some of the symptoms that we find when someone has cancer that has progressed. Very late stages again, very severe backache. Unaanza kupoteza kilo. Kama ni mkojo inakuja kidogo because there is already an obstruction. Kuna tumor pale inaifunga. Kuna anemia because you're bleeding now and then. So unakosa damu kwa mwili. Urinary incontinence. Wakati nimesema mkojo inatoka bila kufahamu. Cervical mass. Unaanza kufura miguu. Unaanza sasa, ikianza kunini kwa lungs, unashindwa kupumua. And you can see now these are stages that actually treating becomes very difficult. You're given palliative care, managing pain, and just looking at the end result. So for our children, now because I'm not seeing any adolescent in here, and no one can qualify for this when I'm looking at you. HPV vaccine is for those who have not started having sex. Okay? So kwa wale watoto wetu wachanga, ni vizuri, if you have a baby 10 years to 14, a baby girl, it's important to visit the facility, kadungwe vaccine, kakuzuilia cervical cancer. Okay? Yes, hiyo ni one of the ways, and it is available in Kenya. We have like 3 types of vaccine. It was rolled out in 2019, but the uptake is very low. Bado watu hawatoi watoto kudunga. How do we prevent cancers finally? We can prevent them before they occur, or we can prevent them in the early stages. That is the secondary prevention. Primary prevention, ni hapo tunasema vaccine, kama hepatitis B vaccine, human papilloma virus HPV vaccine. Then you control yourself. If you're living with HIV, you make sure you take your treatment well. If you have any other, like diabetes, hypertension, make sure you manage whatever you're living with well with treatment, because we don't want your immunity to go down. avoid a lot of x-rays and radiations. Yes? Kwanza siku hizi, there is something I was just thinking and we need to look at it. Every time we are doing our nails, yes? Some of these machines, they have some radiations. Yeah? Na unapata saloon zingine, hata wanakuekelea hapa kwa paja tu. So you're just having those radiations in your body. Let's be very careful, okay? As much as you want to look beautiful, look at what you're exposing yourself to. Promotion of healthy diets. Kukula tu vizuri. Si kukula expensive. Kukula vizuri. A balanced diet. Fruits, veggies, legumes, whole grain and nuts. Manjugu. You know, low in saturated fats. Tuangalie kile tunakula. Alafu to exercise vizuri. Na to minimize exposure to aflatoxin. Aflatoxin ni ingine inaleta a lot of issues in Kenya. Because kama saizi yaki tunapenda peanut. Sindio? Tunapenda nini? Peanuts. But those who are preparing the peanut at times mix mpaka zile nini ziko na aflatoxin. You know aflatoxin? If the grain inaanza kupata kale kanini kamuozo pale ka blackish and they don't select, si zinapelekwa tu zinasiagwa zote. So we are exposing ourselves to so much. And of course tobacco and alcohol control. Secondary prevention, ni hiyo tumesema. You get to get detected early and then available interventions are given to you so that you can be able to prevent yourself from the cancer itself. Finally, the last slide, what can we do? We have said each one of us has a role to play. One, look at our lifestyle. We have talked about it. Do the screening and get the vaccination to our children especially. Tuko pamoja? Can we say thank you? What's the time? I don't think I have time for STIs. I do a few? Okay. Sawa sawa. Before bring my presentation on STI, but mmepata kitu? Wamama mnasaidika kweli? Ama nilikuja hapa kuabo? Mnatusaidia? Aya, sawa, asante. Do you have any question? We have even Daktari pale. If you have any question, we can answer together. Any question? And if you feel you can't ask, just write it down. And then we can get it and answer in the afternoon session. Sindio Daktari? So write your questions, bring them. They'll have an afternoon probably session to answer all those questions. Okay. So for STIs, I will do a very brief summary. Because STIs, there are so many. However, because I work with National AIDS Control Council, the currently called National Syndemic Diseases Control Council, there is a slide I have to present to you. And that is my slide on HIV situation in Kenya. It is something, for us, HIV is no longer an issue. Sindio? Hata ni ngumu sana usikie mtu akimention mambo za HIV sahi. But is it there? It is. Is it being spread? Yes. So, mbona tumeenda chini, hatujui, na hatujikingi anymore. And especially if you look at these statistics currently, this is 2023 statistics, the most current, is that 3.7% of the Kenyan population is living with HIV. That is around 1.2 million people. Yes? 1.2. Who are more affected than the others? Women again. Women are really disadvantaged. The reason, still stay on that screen, is 5.3 of women are living with HIV, while 2.6 of men are living. As in inusu. You know, yeah, we are times 2 at risk. Something I want us to look at is the rate at which our adolescents and young people are finding themselves contracting HIV. Of the new infections that occurred that year, that is the 2022 year, that is what we call 2023 statistics. Last year, 41% of the new HIV infections in Kenya were from adolescents and young people, aged 15 to 24 years. Yani zile infections tulipata last year mpya in Kenya, zile zote zilikuwa in Kenya, 41%, almost 50%, zilikuanga kwa maana 15 si ni watoto, 15 to 24 years. Hiyo inakwambia tafadhali linda mtoto. Okay? Mwelekeze kwa njia ambayo yes. And have time with your children. Woman of influence, start by influencing your own. Yes. Because now if we continue with this, we'll not have a healthy generation. Tutawafunza, maana unasema na kutafutia school fees ndio maana sipatikani, but by the time you're getting that school fees, kuna mtu hapo. Okay. So it's always important to look at that. So when I look at HIV, I'll not even talk much about HIV, but it's just one of the infections. Rush my slides to the next one, HIV tunaijua, what it means tunajua. Next slide. Transmissions tunajua. Wale wengi upata HIV through sex. Ingawaje kwa wamama, it's important to note that if you're living with HIV, tembelea kituo cha hospitali uweze kupewa dawa. Ndio hata ukiwa na mtoto mimba usiambukize mtoto wako. It is possible for you to carry a baby when you're HIV positive and deliver HIV negative child. Save the life of the next generation by visiting the facility and ensuring you get your treatment and you continue taking your treatment. I want you to go to slide number I'll not talk much about HIV today. Let's go to another STI, number 20. Sorry. Time. 20. Ntarusha. Next time mtanialika na masaa. Sindio? Masaa mingi. Okay. Slide number 20. Good. Hizo ndizo STIs ambazo zinakuanga sana in Kenya. There are so many. Yeah? Gonorrhea, syphilis, chlamydia, chancroid, warts, simplex, HIV, na ile tumesema human papilloma virus. Hiyo mmejua sasa. Yeah. So ukishika mambo za chlamydia ni bacteria. Next slide. Na sana tunaipata kwa watoto tena 15 to 24 years. They are so sexually active. Yes? Hii ni ile sana unasikianga watu wanaita nylon. It has discharge like nylon. And 50% have no symptoms. Hakuna symptoms. But ikikushika utapata ni hiyo discharge. And it looks like the next slide. Just go to the next slide. I'm sorry I have to bring all these slides to you. Yeah? That discharge, can you see the white discharge? That's how it looks like for ladies. But iki affect wanaume, it affects the epididymis. It affects the testis. Can we see the next slide? Inakaa hivyo. Inafura, By the way, do you know how is it a sin? Do you know how the genitals of your spouse look like? Yote inakuanga anda kwa giza. Kila kitu ni kwa giza. Lazima to switch off lights na lazima tufunge macho. Wengine wanaangalia wanashinda huyu madam anaongea nini sasa. From today, switch on the lights, open your Yes? Examine, see what is entering into your body. I'm not being naughty. I'm just telling you the truth. Because for STIs, some things you have to see. Okay? You have to see. So if you don't know the normal, you can't know the abnormal. Okay, gonorrhea, the second most. To me, niko slide. Enda kuenda. Next. Aya. The second most common bacterial STI is gonorrhea. And currently in Kenya, we are getting even gonorrhea ambayo inashinda madawa. Imagine. Sasa nini HIV, sasa hata gonorrhea ingine ambayo imeresist madawa. Now most common people, 15 to 29 again. It can affect the cervix, the urethra, the rectum, depending on the style that you have. And it can be treated with antibiotics. Often, no symptoms, especially for females. Sasa hii wanawake wanafikiria wako sawa, lakini kumbe walishapata gonorrhea. Next slide. So sana sana utapata, there is always a yellowish, greenish discharge from the penis, from the vagina. Kukikojoa, unasikia uchungu kama mwanaume. There is pain on the testicles. There is rectal pain for those others. Bleeding after sex for a woman. Pain after sex. If you first start getting pains or bleeding after sex, there is something wrong. It's not normal. I hope I'm talking to married people. Okay. There is no under 18. If you have an under 18, umfunge masikio na macho. Gonorrhea, next slide, looks like that. Okay? Hizi ni sehemu Mungu alitupatia. So me, I don't usually find it hard to display. We are beautifully and wonderfully. Yeah. So any discharge from the penis then needs attention. Let's go to the syphilis. Syphilis is also bacterial. Let's go, and it has stages. The first stages, you'll find it can just be a painless, kakidonda tu akana uchungu, it's called a chanka, na kanaenda, alafu kanarudi tena. Then ikifika the next time, secondary, I'm not talking about the pimples you get before menses, okay? This one ni kakidonda. Kakidonda kanakaa tu, nitawaonyesha, sijui kama niko nayo hapa. Then secondary, unaanza kupata some rashes on your palm of your hand, the soles of your feet, nywele inaanza kukatika na si ati ulikuwa umesonga, and you're just feeling sickly. That is the secondary one. Then after that, the lesions, yo kakidonda kanaenda kakirudi. And it can complicate to the last, to the tertiary stage, ambayo inaenda kwa heart, inaenda kwa brain, and syphilis can really make you go mad. Mwenda wazimu, just because of syphilis, which can be treated. Na pia ukiwa mjamzito inapitishwa kwa mtoto. You can imagine. Yeah? And it can affect all other systems in the body. Hiyo sina picha yake. Let's go to the second last one. Genital herpes. Ama tunaita genital herpes, simplex virus. Do you know tule tuvidonda tunakuanga huku? Twahoma. It's a virus, but I'm not saying it's sexually transmitted. We have two types. Kuna hako kenye unapatanga ka viral flu, na kuna ile unaweza pata kwa genitalia, that is sexually transmitted on your vagina or penis. So they are very painful. Tuvidonda, very, very painful. These ones, most of the people will come to the hospital because the pain is too much. They look like, show them, yes, like those ones, blister-like. They are so painful. Those ones, most of the people will have to come to hospital, whether they like it or, yeah, because of the pain. Go to the last slide. I think I've already talked about HPV, but I want to show them something. The HPV signs and symptoms. Next. Yes. So HPV tumesema ni human papilloma virus. Many people with low risk types have no symptoms. Tumesema ziko over 100 subtypes. Mingi zinaendanga tu na zinapotea zenyewe. But others, there is a specific HPV that do not cause the cancer of the cervix, but now inaleta hizi vitu kwa your genitalia. So what happens is you get the warts. Unajua what? Kitu itu imemea inaka kinyama tu. So it happens on the vulva, on the penis, on the scrotum, call it, and it's a bit itchy. You just feel like scratching, and it's very uncomfortable. If you scratch it, it starts bleeding, and it's like that. Just go next. Something like that. Kitu tu imemea. These ones, of course, they are exaggerated, but it's just to help you to see, so that if you see one, you don't wait for 100, okay? Yeah, it can just be one. It doesn't have to be all this. But the more you continue staying with it, the more inaendeleanga mpaka inaweza funga the orifice. So, STI basically is something that we can treat. Sana sana, all those that are caused by bacteria, you're just given an antibiotic na inaisha, and then you're told you need to be treated as the two of you. Because moja akikunywa dawa mwingine hajakunywa, hujafanya kazi yote, and then you have to go have sex again with someone who is not treated. So you have to be treated, both of you, and you can abstain until you're okay. Then now you can continue with your conjugal rights later. So for any discharge, for anything that you see that is not normal, that is what I am ending with, please go to the hospital for checkup. Tuko pamoja, and may God bless you so much.
Bwana asifiwe. Hiyo mambo mimi siku hizi siongeangi, niliokoka. We thank God for you, Jenny.